Good morning, everyone. Today we'll teach you how to become better physicians by understanding spirometry and pulmonary function testing. The first thing you want to notice is the first graph, which is your spirogram. The spirogram on the x-axis, you'll notice time, and on the y-axis, you'll notice the lung volume. So when you're breathing normally, you're not making any effort. You're simply breathing. Normal day. You're walking in the street, whatever. You inspire a certain amount of air, right? This will be called your tidal volume inspiration. This is the total amount of volume that you inspire in your lungs. It usually is about 500 milliliters in adults. And alternatively, if you were to expire that volume of air, it will be called the tidal volume expiration. Cool. So this is your tidal breathing, right? Normal. If you were try to inspire as much air as you possibly can, we will call that the inspiratory respiratory volume. This is the total amount of volume of air that you can breathe in as you possibly can. The normal volume of air that you have in your lungs is about 2,500 milliliters or 2.5 liters. If you try to bring in air, it's about 3,000 milliliters or 3 liters. And if you bring out air, it's about 2,000 milliliters or 2 liters. Alternatively, if you were to expire as much air as you possibly can, if you're blown out from an exercise and you're just like, you're breathing out all the air, that will be called the expiratory respiratory volume, ERV. Okay? Now, you will notice that there is a small gap right here in between 0 and this volume. It's called RV, residual volume. The residual volume is the amount of volume you have in your lungs that will avoid collapse. Basically, you don't want your alveoli to be fully collapsed if you try to breathe out as much air as possible, because eventually you're going to want to have more air in. And if you have collapsed alveoli, that'll be either very difficult or impossible. And this is what you'll see in patients who basically have collapsed lungs of pneumothorax. They won't be able to have any air in because it'll be super painful, and also surface tension will be super high, and it's just not a good time. Now, the other concept you need to understand is the vital capacity. The vital capacity is the total amount of air you can possibly have in your lungs at any certain given time without the residual volume, which comes down to our down and last point, which is the total lung capacity, LCT, right here. The lung capacity total is the total amount of volume in your lungs that you can have at any possible moment of time, including the vital capacity and the residual volume. And that is about 6 liters in an adult, or 6,000 milliliters. Okay, cool. Now you've had the experience of understanding what a spirogram is, so you understand how normal breathing works and how that volume affects a patient. Okay, cool. Second thing you want to understand is this loop right here. So in trying to assess a patient, whether they have a pulmonary disease, which can either be an obstructive one or a restrictive one, a patient will be able to have a pulmonary function test called a spirometry. A spirometry is basically an apparatus you put on the patient's mouth, and you ask the patient to inspire as maximum amount of can and expire for the longest amount of time and the most amount of force they possibly can, depending on their situation. Some patients may not be able to do that, and from that you'll be able to understand that they have a pulmonary disease. Okay, so we'll go into this graph first, and this is what a graph will look like if you were to perform a spirometry on a normal patient. So this is a healthy patient who expires as much air as they possibly can over the longest amount of time. And usually that takes about 4-5 seconds if the patient is quite big relatively. On the x-axis, you'll see the time again, and on the y-axis, you'll see the volume. Okay, so the first concept you want to understand is FEV1, which is your force expiratory volume in 1 second. So if you were to expire as hard as you possibly can, this will be about 80%, 70% in a normal adult male. Okay? Later, alternatively, you'll see about 4 seconds after, you will have the total volume that you can expire, which is your forced vital capacity. This is the volume of air you have right here that you're trying to force out. It's that extra bit right here. This is why this difference here is also that difference here. You're expiring a little bit more air, and you're just trying to blow out as much air as possibly can. Now, as I said before, the FEV1, which is about 80% in normal healthy patients, or 70%, there's always going to be that, that 10% standard deviation to from depending of the age of the patient and the size, etc., like how big these people are. This will be your Tifino index, okay? The 70 is the ratio between the FEV1 and the forced vital capacity. Now, depending if you have less or more, will tell you the bracket of pulmonary disease that your patient will have. Now, let's say you're assessing a patient who has an obstructive pulmonary disease, which, let's give an example, emphysema. So what is emphysema? Emphysema is when you have low elastic tissue in your lungs, okay? Your lungs, right here, for example, are trying to inspire and expand as much as they can, but if they have low elastic tissue, they also have a higher compliance. So normally you have elastic tissue that keeps your recoil in order and pushes air out of the lungs, right? While in emphysemic patients, they will have a really low elastic tissue and won't be able to recoil. This will cause the patient to have a lower FEV1, which means that they can respire less air in. And obviously, if you look at this ratio, if you have less FEV1, what will do the math? Well, it won't go more than 70%, it'll be less than 70%. So this is one way of finding out if the patient has an obstructive pulmonary disease. Now, the complete opposite is having a restrictive disease. An example of that could be an infection in the lungs or fibrosis. And the patients who suffer, for example, from fibrosis, they will have really a lot of elastic tissue. This is the complete opposite. Their lungs will have a really low compliance, so they won't really be able to suck in as much air, but they'll be able to push out, and that will cause them to have a lower lung compliance. If you have lower lung compliance, you'll also notice that the graph will look like they have a lower FVC, and that means the lungs can't expand properly. And if you can't expand properly, you'll also have trouble ventilating. And these people will have a higher score. So if you look at the index, if you were to do the math and have, for example, 4 here, 5 here, 80, right? This is a normal patient. But if you have a higher FVC, like 4, 4.5, it becomes 90. So in that case, these patients will have a higher Tifino index. And that, guys, is how you understand a spirometry and pulmonary function testing with how different volumes affect the lungs. Thank you for watching.